I'm the practice administrator of crisis services, justice initiatives, and disaster response at Integral Care.
How is COVID-19 and the response and reaction to COVID-19 impacting the work that you do?
We want to make sure the public always knows, but especially knows right now, that there is not one of us that could not benefit from getting some emotional support right now and hopefully intervening before it becomes a mental health crisis. And I know we're going to talk about signs and symptoms of a mental health crisis later, but I want to make sure that we're emphasizing that Integral Care wants the community to call and to ask to speak to a mental health professional about the changes they're experiencing, the impact they're experiencing from COVID-19. And the way they can do that is by calling our crisis helpline, which is 512-472-4357 or 472-HELP. Press option 1 for hotline. And when the qualified mental health professional answers the phone, simply let them know they'd like to speak to a counselor about everything that they are experiencing right now, all the stressors they're experiencing right now. This has touched every single one of us. And something I've heard people say a lot is, well, yes, I'm experiencing all these stressors, but I have it so much better than this group of people. You know, at least I have a job, or at least I don't have kids to help do school right now while I'm working a job. And what we would like people to know is this is not a contest. Everyone is impacted by the changes that have occurred in our lives due to COVID-19. And we encourage everyone to reach out for that emotional support. That option is available via our hotline 24/7. It is free and people can remain completely anonymous. It can be completely confidential.
You don't have to be in crisis. You can just call the number, even if you just have something you want to talk about and it's not a crisis.
That's absolutely right. There is no one in the community right now that couldn't benefit from some additional emotional support due to the trauma that is resulting from the changes in everyone's lives from COVID-19. And we want people to feel free to call at any time, day or night, 472-4357 to talk about the stressors they're experiencing and get that emotional support that we could all use right now from a mental health professional.
Talking about signs of mental health crisis, I know generally speaking, a lot of our coverage has mentioned things that people can do to improve their mental health,
Sure.
Getting sleep, taking deep breaths, getting regular exercise, writing in a journal, seeing a therapist. But what happens when things get more serious? Can you talk about what some of the signs are that you or somebody who you care about is really getting to a not healthy place when it comes to their mental wellness?
That's a really good question. And it's a question people usually have because, quite frankly, we're not as educated as a community about our mental health the way we are about our physical health. And the question is coming up even more now, well, you know, isn't everyone's mental health affected right now? When does it get to a point where you should be worried about someone or be worried about yourself? So I want to make sure to make clear that everyone right now is experiencing an impact on their mental health due to changes and stressors that are coming as a result of COVID-19. However, there are still some signs that you should be on the lookout for that would indicate that a person really does need professional help within the same day. Some of those might include not being able to sleep for days at a time. I understand that right now, a lot of people's sleep is being impacted, but I'm talking about people that haven't been able to sleep for days at a time, or people that have been unable to get out of bed for days at a time. People who have not eaten for days at a time. When someone is showing signs of confusion, the things that they're saying don't make sense, or they seem to be having trouble distinguishing what is real or what is not. Sometimes people may hear voices or hear things that aren't there, or see things that don't appear to be there. When people experience what I would call a numbness for days or weeks at a time, that's a sign that a lot of people aren't aware of, but it's a sign that often indicates that someone may be on the brink of experiencing a mental health crisis or is experiencing a mental health crisis, particularly in response to trauma, which is what a lot of us are experiencing right now with the sudden drastic changes. Severe, rapid mood changes or mood swings is something to be on the lookout for. Severe isolation from others. And what I mean by that is obviously we're all isolating somewhat right now with social distancing requirements. But people who are not engaging in any type of social contact, even with the people who live in their same residence, they're not answering their phone, they're not engaging in FaceTime or Zoom calls, things of that nature. The other thing, the most important thing that would really indicate someone needs immediate professional intervention or assessment are thoughts of killing oneself, and much more rarely thoughts of harming other people. But if someone is talking about having thoughts of killing themselves or making statements that indicate that might be what they're talking about, that would be a definite sign that someone needs immediate assessment and intervention to ensure they're getting the support and intervention that they need. I know that you had sent an email asking me about how do you talk to someone that you're concerned about? And specifically, you had asked, how do you talk to someone that you know lives with a mental health disorder or lives with a mental health challenge? So what I'd like to say is, to anyone who is concerned about another person's mental health or about your own mental health, you don't need to have a high bar to call our crisis helpline and talk to a qualified mental health professional about what you're noticing, what you're concerned about. And that person will give you their recommendation about the next best step. It's been our experience that a lot of times people hesitate calling a crisis helpline or reaching out for help because they don't know all the details, or they don't know for sure if what the person is experiencing is a crisis. That's not the community's job to figure out. What we want to encourage people to do is, if they're concerned about anyone, they should feel empowered to reach out to that crisis helpline 24/7 at 512-472-4357 or 472-HELP, and talk to that qualified mental health professional about what they're concerned about. The person on the other line can offer different referrals or linkage to referrals that offer anything from emotional support to in-person intervention, to telephonic intervention, to telemedicine intervention. If someone's concerned about a person that they know lives with a mental health disorder or mental health challenges prior to all the changes that have occurred due to COVID-19, it's really important that people check in with those folks. A lot of times people hesitate to talk to others about their mental health problems or mental health disorders because they don't want to embarrass them or they don't know what to say. It's critical, if a person feels comfortable, to reach out to their loved one and to say, hey, I know that you live with depression, bipolar disorder, or I know you live with these mental health challenges, and I can only imagine how all of the changes due to COVID-19 are impacting you. What can I do to help? A lot of times when people are concerned about others, they ask, they say, let me know how I can help. We really encourage people to pivot from let me know if I can help to what can I do to help? What can I do to support you? It's also important for the community to know that if they're not comfortable with that, or if after that conversation they're still feeling very concerned, they should call our crisis helpline, discuss their concerns with the qualified mental health professional, and our helpline staff can reach out to the person that they are concerned about. And the person can remain anonymous, that information can remain confidential, but we can go ahead and reach out to the person and let them know that someone's concerned about them and we'd like to help if we can. Integral Care is still providing its full array of crisis services. We are shifting to telephonic and telemedicine interventions when possible, but we are still seeing people face-to-face by appointment when that is the more appropriate way to go. We want the community to know Integral Care is here to help, from everything from a person's emotional support needs, just dealing with the fallout from all the changes from COVID-19, to providing intensive crisis intervention services.